This is
And so
why
they
puberty
had
blockers
everything
pose grave
going
risk to developing
taking
children.
children who believed they were the opposite sex, or one of the kind of made up sexes in between, and then plugging them into the clinic where they would get started on puberty blockers at Tanner stage 2, which is before the onset of pubertal development, right? Before the onset of secondary sexual characteristics like breasts or pubic like hair growth, and then
So
after
just to be
that.
clear, how old were these children that they would be putting the puberty blockers, giving the puberty blockers to?
11 years old was the youngest I've seen.
Wow.
And important to know that these blockers are just as severe, if not more severe, than the most radical surgeries, because it's like having a million microsurgeries on every single cell in your body. And they do it, the effects these hormones and medications have is to change almost every single natural physiological structure in your body. Because, there's no surgery in the world that can deprive your brain of the hormones necessary to become an adult, or, make your bones as brittle as like an old woman, and that's what they're doing to these kids starting at the age of 11 years old.
So just to be clear for folks listening, what are the consequences, the potential risks of starting to take puberty blockers at 11 years old?
A good way to initially put it is, so these are the same medications they use for advanced prostate cancer, Lupron, right? Because it castrates the hormones from an individual's body, right? It like shuts the whole system off. And a lot of these older men can't tolerate it because they have such severe mental responses to it. They get depressed, they lose all of their energy, they go into menopause, they have hot flashes. They can only do it for a couple of months before they can't tolerate it. And they're doing this kids who are 11 years old. But it's more than that when you do it to a kid, because what happens is they essentially do not go through puberty. So number one, most importantly, you will sterilize them because you don't undergo the exposure to the hormones that allow the maturation from immature sperm to mature sperm, or immature eggs to mature eggs. So if you never undergo that process, you never develop the cellular architecture necessary for fertilization, right? And then you can also develop, like in boys, a permanent micropenis, like in the case of Jazz Jennings, right? Because his puberty was blocked, he never underwent the growth of his sexual organs.